Welcome to POTUS 2016, where we call the presidential horse race and pour cold, hard facts on the overheated campaign rhetoric. Today, what does the GOP have in mind to replace Obamacare if they do get a chance to repeal it next year? And in our evidence-based politics segment, how much does international trade really affect jobs and wages? NAFTA by the numbers. But first, are the front-runners still galloping ahead? Yes, time for the horse race. On Tuesday, NBC News and SurveyMonkey released the results of their weekly election tracking poll, which showed that a majority of Republicans now trust Donald Trump over House Speaker Paul Ryan to lead the Republican Party. It's another sign that the GOP is becoming Trump's party, not the establishment's. After his Oregon win on Tuesday, and with 350 delegates up for grabs in primaries ahead, Trump stands just 80 delegates away from landing the officially required 1,237 majority of delegates he would need to clinch on the first ballot at the Republican National Convention in July. On the Democratic side, Hillary Clinton is now a mere 90 delegates shy of securing the nomination, but that includes superdelegates who can theoretically change their minds. Tensions within the party remain high. On Tuesday, Bernie Sanders scored the majority of Oregon's delegates and also took home half of Kentucky's share with a razor-thin 1% of the vote separating the two candidates. Clinton chose to remain out of the limelight as the results came in on Tuesday, but Sanders was turning up the heat in front of thousands of his supporters in Carson, California.
The Democratic Party is going to have to make a very, very profound and important decision. It can do the right thing and open its doors and welcome into the party people who are prepared to fight for real economic and social change. That is the Democratic Party I want to see, bringing in people who are willing to take on Wall Street, to take on corporate greed, and to take on a fossil fuel industry which is destroying this planet. So I say to the leadership of the Democratic Party, open the doors, let the people in.
Let them in. Sanders wants independents to be able to vote in all the Democratic primaries next time around, and he's holding out hope that a big California win next month will sway superdelegates to his side, or at the very least continue to bolster his claim to influence the Democratic platform at the convention in Philadelphia. Bernie Sanders' campaign has already helped convert the presumptive Democratic nominee Hillary Clinton on the very hot issue of health care reform. Under pressure from Sanders and congressional Democrats, Clinton recently suggested allowing Americans above the age of about 50 to purchase Medicare coverage, putting her one step closer to Sanders' proposed Medicare for All plan, aka single payer. Calls for wide-scale reform are coming from the Republican side as well. With health insurance premiums set to rise for many in 2017, Republicans are using the issue to garner votes in November and are calling for a repeal of Obama's Affordable Care Act. But what would it be replaced with, as millions of lives are left in the balance? Joining us from both sides of the debate are Paul Howard, Senior Fellow and Director of Health Policy at the conservative think tank, the Manhattan Institute, and Dr. David Himmelstein, Professor at the City University of New York School of Public Health, Hunter College's School of Public Health, and co-founder of Physicians for a National Health Program, a group of 20,000, they say, American physicians, medical students, and health professionals advocating for single-payer reform. Welcome to both of you. Thank you very much for coming in. Let me start with Trump and his meeting with Paul Ryan. Paul Ryan is a longtime advocate of moving toward more of a free market healthcare system, moving toward states rather than the federal government controlling more of how government healthcare is distributed. How close is Trump to Paul Ryan as far as we can tell?
On boilerplate, if you look at Trump's healthcare webpage, they're very close on some issues and further apart on others. On repeal and replace, they're very close. They use a lot of the same language on Obamacare being an economic disaster for the country. Trump calls for repeal and replace. Trump also calls for block granting Medicaid and some other traditional Republican planks. On the other hand, he's farther apart on issues like prescription drugs, where he calls for drug importation, drug price negotiation between Medicare and drug manufacturers. So I think that what Trump is going to look to do is probably triangulate and even steal some pieces from left platforms to compete with Hillary.
And let me just pick up on a couple of those things and explain them to the listeners and viewers and follow up. When you say block granting Medicaid, that's instead of the federal government giving the benefit to individuals, letting states do that. I know states already have a role, but more giving lump sums of money to the states on the theory that states could do it more efficiently. But Democrats and liberals fear that that's going to let the states that want to be cheap, a lot of southern states, be very cheap. And it's going to leave more people sick, more people impoverished. So what's the block granting argument as you see it?
Right. The block granting argument is you look at states like New York that spend far more than much poorer states like Louisiana, but still don't get good health outcomes. Medicaid spending tends to crowd out spending on other goods and services, including other safety net services. So the idea is if you say to states, we're going to give you a set amount of money depending on your population, the number of poor people, the number of people who have disabilities, and other factors that adjust for the health of the population, you can get states to spend that money more wisely and even negotiate harder bargains with hospitals and health plans who cover those populations.
As a single payer advocate, do you want the federal government to remain in control of that, or could states, it's still Medicaid, could states do a better job?
Well, Paul's mentioned Louisiana. My wife trained in Louisiana. She's a physician. And the horrors in Louisiana for poor people and for black people are really indescribable. And really, block granting means that the racist and anti-poor elements of our country are allowed to run roughshod over people. And it also means that the federal government can evade its responsibility to keep up with the rising costs of health care. So the block grant doesn't go up as fast as the cost of medical care, and that means that actually poor people's care is squeezed. And that's really the proposal at its base, is to say, let's squeeze poor people's health care and let's let states abuse poor people, and particularly black people, as they please.
Now, that's just wrong for a couple of reasons. For one of which is New York's a wealthier state. It spends an awful lot more money. So what we could say is we're going to take some of that money and give it to the poor states that don't have the money to spend. You can also make the block grant grow faster. I think one thing that both left and right agree on is the U.S. spends too much money on healthcare. Healthcare costs go up too fast, and we're not getting the quality we want from the healthcare system. I think we do need to hold states accountable for outcomes. We're not doing that now. We're giving the states a blank check and saying whatever you spend on healthcare, no matter what the outcome is, we'll reimburse that $2 federal basically for every dollar that a state spends. So actually this would tend to help poorer states that can't keep up with the spending of juggernauts like New York.
If you think that Louisiana, Mississippi would actually spend wisely to help the poor, I invite you to see they've been offered free federal money for Medicaid under the Affordable Care Act. They've turned it down, as has Texas, and that's led to thousands of deaths. So the claim that somehow giving unrestricted money to states to spend as they want on care of the poor, or not spend as they want, is a good way to go. It's just a bizarre claim. And though Paul may say that the block grants could go up faster than I say, in fact, the proposals that have been on the table don't call for that.
Another thing that he mentioned that's more on the Democratic side that Trump seems to embrace is the importation of drugs.
Yeah.
So I presume that that's something you support. Explain to me why, from your perspective, we don't, I guess this means consumers, if you want to buy a drug at Canadian prices rather than higher American prices, higher in many cases, you can't legally do it. You have to do it on a black market.
Yeah, that's the case now. Frankly, what would make more sense is to get Canadian prices, not Canadian drugs. And the reason we don't have Canadian prices is they bargain with our drug companies because they have a national health insurance program that has the leverage to bargain prices down, and we don't. So a lot of those drugs...
Medicare, a lot of people don't know this. Medicare, which is of course so huge, it covers so many Americans over 65, it is not allowed to negotiate with drug companies under U.S. law, correct?
That's right. It's forbidden to negotiate with drug companies. And, you know, a lot of the drugs we're talking about importing from Canada are in fact American drugs that we export to Canada, and then we'd like to import them again because we can get better prices that way. And it makes much more sense to just import the prices.
Why can't our biggest insurance company, which is the federal government, negotiate price with pharmaceutical companies?
Well, actually, Medicare does get negotiated prices. Medicare Part D, which covers the prescription drug benefit for seniors, has health plans in it that negotiate very big discounts with private health plans. It retains choice and competition without reducing incentives to innovate.
You're talking about the private providers who Medicare sometimes works through if individuals choose them.
Exactly. So you have large insurers like United Health that in some cases cover more people in their plans than countries in Europe have populations. They get very big bargains. A recent report from PBM, that's a pharmaceutical benefit manager like Express Scripts, one of the largest in the country, said they held down drug prices to about 5%, the rate of healthcare inflation last year. So you do have lots of bargaining going on in the healthcare system. The bigger question is...
Of course, that doesn't apply to hospitals and inpatient care, which is where much of the very expensive drugs are actually used. So that's really just on the outpatient side. And the patients, by and large, aren't for their share, for their co-payments and deductibles, aren't getting the benefit of much of that bargaining.
Medicare Part B and the healthcare system as a whole.
Part A is the inpatient.
No, I'm talking about Medicare Part B covers physician and hospital administered drugs. Medicare Part A covers hospital services.
No. I think you haven't worked in a hospital actually. When you're an inpatient and you get a drug as part of your inpatient care, that drug is covered under the what's called diagnosis-related group, and that payment is set. It's not flexible in the way you're suggesting, and those drugs are not under Part B; they're under Part A.
No, but the Part B ones that you're referring to would be the ones that are not "quote-unquote" negotiated by Medicare. Right. If it's included in a DRG, the price is set.
But when I administer a clot-busting drug to a patient with a heart attack, that's thousands of dollars, and that's not negotiable by any insurer. That's each hospital negotiating one at a time.
Good. I think the viewers get your differences on some of that, and I want to move on to another issue and actually move to the other party now. Hillary Clinton, as I said in the intro, has moved closer to Bernie Sanders' Medicare for All position in a way by very recently floating the idea of letting people in their 50s buy into, not just be covered by, like people over 65 are, which is automatic, but buy their way into Medicare. As a proponent of Medicare for All or single payer, do you think that would be a significant step?
I think it's a tiny step, maybe slightly good in some ways and frankly slightly bad in some. What I fear is that it actually provides the insurance companies that are previously insuring many of those people with a way to dump their most expensive and least profitable patients onto the federal government. So we know that they design their policies to discourage expensive patients from being privately insured and try and dump those patients elsewhere. And Medicare presumably wouldn't design its policies to avoid those patients. So in effect, what I fear is that it would become yet another government subsidy for the private insurance industry.
What do you think about that idea?
Well, look, in order to make it affordable for those people, you'd have to heavily subsidize it, which would bring up costs for taxpayers. It's not a kind of solution. I think what you need to do is bring down prices on the private market, make those plans more affordable for everyone right now. Under the ACA, a lot of middle-class people with very, or at least higher incomes, but who are in relatively good health, aren't able to afford ACA-administered plans. I think that's where you want to look, and potentially also the place for a Republican Clinton administration or Trump administration accommodation on fixing the ACA.
Why isn't that a good place, that is people in their 50s, to spend taxpayer dollars? One could argue that if there's going to be an expansion of the healthcare system, of government subsidized coverage, that's exactly where the need is. People who are in too many cases unemployed or underemployed in their 50s as they near retirement, and early 60s, but not yet old enough for Medicare. And that's exactly the group that government should be helping more.
Right. The Republican solution to that, or the conservative perspective on that, is we should equalize the treatment between individual insurance and employer-based insurance. Right now, people who have employer-based coverage get a very large tax advantage from that coverage, get it purchased at relatively low prices. Ensure that everyone, no matter what their age is or where they get insurance, basically have the same benefit and can find affordable coverage. So that preserves competition and choice in the system, and at the same time helps to make that insurance more affordable for those people.
If you could design a plan from scratch, and I'm going to ask you for this sort of 30-second to 1-minute version, and you could repeal and replace Obamacare, what would you replace it with?
Well, I think what we do is something that the ACA tries to do, but I think ultimately fails, which is level the tax treatment. Again, level the amount of money people get to buy coverage, ensure that there's transparency and competition in the market, and that no one who wants coverage goes without coverage. So we have carrots and sticks to get people to buy coverage, stronger perhaps than the ACA has right now, and the coverage is more affordable. And at the same time, we have providers and insurers competing on outcomes, and that's what we actually want. Deliver better health at an affordable price.
I'm not sure how that works. If you oppose the individual mandate, which requires that people buy coverage if they're not otherwise covered or pay a tax penalty, what's a stronger carrot or stick?
Well, the ACA's mandate is actually not very strong. For people, it caps out at about 2.5% of income, I think, or $2,500, whichever is more. But the problem there is if you're making $100,000 a year, you're not getting any ACA subsidies to purchase coverage, then you're willing to pay a relatively small penalty to not buy coverage that might cost $10,000 or $15,000 a year. But if you strengthened, let's say, the open enrollment period and said you had to buy it in this open enrollment period or you're going to lose some part of your subsidy, that would be a stronger incentive. I think that really the debate is around the best way to structure it. Conservatives are a little bit allergic to the mandate, but there are other ways to get people to buy in.
Would you keep, do you think the conservatives in Congress would keep some of the most popular things about the Affordable Care Act? No denial for pre-existing conditions. Similarly, community rating, which means if you're the same age as everybody, people of the same age in the same geographical area get charged the same premium. So if you're sick, you don't get gouged. And keeping people up to age 26 on their parents' plan if they want?
I think they would keep a lot of the most popular things. I think they'd give a little more flexibility in things like age rating. So if you went from, let's say, the ACA's 3-to-1 back to 5-to-1, or gave more flexibility for younger people, healthier folks, to buy plans that might have a little bit less coverage at the margins but was more attractive financially, you get more of those people to buy into the system and stabilize the risk pool on the exchanges.
And your ideal, obviously single payer. A lot of people are afraid of the government. They don't like their insurance companies making decisions about what's covered. Yeah. They don't want the government making every single decision about what's covered.
Yeah, I have the same kind of problem, frankly. I have the FBI file to prove my distrust of government. But in the choice between an insurance company that I have no right to vote for and have really no right at all to supervise, and government, I and most other people actually, according to surveys, would choose government. And not only that, but it saves an enormous amount of money. So our private insurance companies are taking about $200 billion in overhead out of the healthcare system each year. And we know Medicare runs for about 2 cents on the dollar. Aetna and Cigna and United Healthcare run for about 13 cents on the dollar. So for every dollar of premium, we only get 87 cents of care. In Medicare, for every dollar of premium, we get 98 cents worth of care. Not only that, but by going to a single payer system, you simplify the paperwork for doctors and hospitals and save a tremendous amount of money there.
Just 15 seconds. Do you dispute the saving from the overhead, no insurance company overhead, as a major factor for the American people?
Yes, because, well, at least in terms of the savings. I mean, on the absolute numbers that this would be a fiscal winner, I point to Austin Goolsbee and other former Obama administration economists who have said that Sanders' single-payer plan, should come with, flying puppies and lotto tickets, that it's going to be much more expensive than he's projected.
But the Government Accountability Office has actually estimated the cost of single-payer and said it saves money, as did the Congressional Budget Office, as did a consulting firm owned by United Healthcare. Right. So yes, the Clinton campaign mobilized economists who are friendly to her to
Including
make
the
these.
Urban Institute?
We will have
Yes,
to,
including the Urban Institute, which had absurd.
we will
the
have to
Commonwealth.
agree to disagree on this part, but we see some of the visions coming from each side, and we will see whoever the next president is, what kind of changes to the Affordable Care Act or to the healthcare system in general are made, because everybody wants to make some. Thank you very much.
Thank you.
Time for evidence-based politics, where we pour cold hard facts on the overheated campaign rhetoric. The three major candidates left in the race have all come down hard on U.S. free trade policies. Hillary Clinton rolled back her support for the 12-nation Trans-Pacific Partnership. Trump rails against the mid-90s North American Free Trade Agreement, NAFTA. And Bernie Sanders says,
Now, trade is not a sexy issue. It is virtually never talked about on television at all, very rarely talked about in the media, but it is of huge consequence for the working people of this country.
so is Bernie right that trade is of huge consequence for working people? One recent study suggests that it's not trade agreements per se, but globalization itself that shifts workers from manufacturing to the service sector, where their wages fall. Here to explain those findings and teach us more about trade is Ann Harrison. She's the William Worcester Professor of Multinational Management at the University of Pennsylvania's Wharton School. Harrison co-authored the forthcoming book, The Factory-Free Economy. The paper that got our attention is called Estimating the Impact of Trade and Offshoring on American Workers. Welcome.
Thanks. Thanks for having me here.
Let's just put up a couple of graphs from your study first. And this first one is going to be exactly what you think, folks. Manufacturing jobs versus service sector jobs. You can see the service sector jobs going way up over time, manufacturing jobs going way down over time. Now let's go to the next graph. And what about the wages? Well, the bottom line is the service sector wages. The top line is the manufacturing wages. So there is that impact of, I guess, roughly $2 an hour on average less for the one than the other, which adds up over 40 hours a week and 52 weeks a year and all of that. But I think your main thrust is that the debate has gotten out of hand and too simplistic. Everybody rails against trade, maybe the number one issue in this whole campaign year, but that it has less of an impact statistically on these job conversions and wages than we think. What's the data?
So thanks for asking. I think that if you look at those numbers, what they tell you is that, yes, there is an effect of trade. So we see manufacturing, which used to account for 1 in every 4 jobs, now only accounts for 1 in every 10 jobs. And so you might say, well, that must be trade. Well, when we do the numbers, what we find is that trade accounts for about 1/4 of that shift. So 3/4 of it has to be explained by something else.
Which
what is that?
Or are,
What are those things? 2 things are going on. One, a lot of companies are replacing people in manufacturing with machines. So that's one big thing. That accounts for a lot of the shift. But if you look at this change, it's been going on for decades. If you saw that graph, it's been going on since the 1950s. Manufacturing generally declines in an economy, services go up, and so it's partly a structural shift. So the politicians are attaching to something long term, something very short term.
but people do get hurt. And some people say, well, the real solution is not to limit trade and put up tariffs, which might reduce prosperity in general, but to have aggressive retraining programs and training for the next generation in the jobs that do exist, so they're not just stuck in service sector positions. Is that where you are?
Yeah, so let me elaborate on that. As we saw, manufacturing jobs are, in the sense, good jobs. So if the same person is forced to leave manufacturing and go into services, they could lose 5%. If it's trade related, they could lose 20% of their wage. So it's true that people are hurt, and that's something that has been ignored generally.
So who does get hurt primarily?
The people who get hurt tend to be the kind of people who are less skilled, who maybe don't even have a high school education or just a high school education, older workers, workers in the Rust Belt, workers in old style manufacturing. Those are the people who are getting hurt.
And is there a set of policies that would really help those people for the years to come?
There are policies that have been suggested. One radical proposal is to simply retaliate and impose a tariff. That has all sorts of negative consequences. There are other things one can do. Last year, President Obama signed the Trade Adjustment Assistance Act, which renews an older act and makes it more encompassing, also applies to service workers, allows workers to get training, money for training, allows them to get compensated for the fact that their wages are going down. Half the workers who are eligible for TAA, as it's known, don't actually sign up for it or use it. So that's a short-run solution. Longer-run solutions are better, but they're tougher, and they're tougher sell for politicians. So let me take the case of an Apple, right? Apple employs around 65,000 workers directly in the United States. It employs about the same number of workers as General Motors, right? Apple's employment has been going up, GM's has been going down, just like in that graph, because Apple's a service company and GM's manufacturing company.
But they make a lot of their phones and stuff in China for cheap.
Right, so what are they doing here? What they're doing here is innovation, technology, design, sales. They're selling it and they're manufacturing it in China. That's the low margin work. And everything that's being done here is the high margin work. So in the longer run, as the US and other industrial nations become factory free, somehow workers need to learn to do these higher paid jobs that America's so good
We just
at.
have 30 seconds left. Will there be enough of those jobs to go around? Because those are elite jobs in our current economy.
There will be if we fix our educational system, improve our infrastructure, and don't resort to tariffs.
Because we want to be able to export, which those jobs are involved with.
Exactly.
Without trade
and we
wars.
don't want retaliation.
Thank you very much for joining us. And that's POTUS 2016 for today. We're here each week at this hour, calling the presidential horse race and pouring cold, hard facts on the overheated campaign rhetoric. Next time, Republican primary results from Washington State and more on the candidates as they enter the final stretch of primaries. I'm Brian Lehrer. Thanks for watching.